Hello, I am Dr. Wong, a psychiatrist at Kaiser Permanente. Feelings of isolation brought on by shelter-in-place orders and social distancing can make all of us feel lonely and maybe even depressed. Older adults with health conditions who are not leaving their homes at all right now may feel lonely, especially if their daily routine included regular interactions with family, friends, or care providers. They may be missing those interactions and concerned about getting the help they need. If you have a loved one, neighbor, or acquaintance who is unable to leave their home, you can help them a great deal just by staying in contact with them and reassuring them. I'd like to share some simple ways you can help ease their concerns and raise their spirits during this time. Check in with them frequently by phone or even better, by video. Seeing your smile and face is calming and creates connection. Ask how they are doing and make sure they have what they need. If they need you to get groceries or other essentials, take the opportunity when you drop them off for an in-person chat, but at a safe distance of at least 6 feet. Encourage your loved one to stick to their routine as much as possible, especially their sleep schedule, eating, medication, and appointments. This might require some flexibility, such as speaking with medical providers via phone or video, something we at Kaiser Permanente are happy to do. Support them in staying in touch with their friends and family and do what they can to help one another. Suggest some creative ways to stay connected, such as video lunch dates, book clubs, online bridge, or exercise sessions. This might even be a good time to explore a new hobby. Encourage them to limit their exposure to news. In these times, media reports can be alarming, so checking the news at a specific, limited time each day helps to stay informed without becoming overwhelmed. And don't forget to take care of yourself. When you are getting enough sleep, eating right, and getting some exercise, you are best able to help others.
Hi, I'm Dr. Bronstein, a pediatric infectious disease specialist at Kaiser Permanente. In this time of school closures and other disruptions to everyday life, many of us parents and caretakers may be wondering how to talk with our kids about COVID-19 and what to do to keep them and others healthy. It's natural to be concerned in times of uncertainty, and this can be a stressful time for youngsters. The important thing to know is, based on the most current information about the impact of COVID-19, evidence shows that children who contract the virus recover well and do not appear to have serious complications. The greater risk is in unknowingly passing the virus on to individuals who are considered high risk, such as the elderly or people with underlying health conditions. For example, a grandparent with heart disease would be at higher risk of developing complications from COVID-19. So keeping children safe and unexposed goes a long way to keep everybody safe. If your child does have cold or flu-like symptoms, it's important to keep him or her home, away from crowded spaces and vulnerable populations. Keep your child comfortable, and be sure to call your doctor for further instructions. Children count on routines, and big changes like school closings could be unsettling to them. Your words and actions can go a long way to reassure them. Talk with children directly about what's going on. Let kids know that children are not getting severely ill from the coronavirus and that they will be okay. The reason that they might have to stay home is because we're all doing our best to protect our friends and neighbors and slow down the spread of the virus so that more people don't get sick. Make sure they know that they can play a helpful role in protecting themselves, their family, and the community. By doing things like washing hands frequently, sneezing or coughing into their elbow, and staying away from others when they're sick, they can help everyone stay healthy. It's best to relay this information in short, brief conversations, and find a time each day to check in and ask what they're hearing and if they have any questions. This will allow you to correct any misinformation they've heard, answer their questions, and offer reassurance. Providing children with daily structure lowers their levels of distress and increases their ability to cope with uncertainty and change. With children home from school, it can be helpful to set a routine for the day. Decide on a schedule that includes a time to get up, a time for schoolwork, lunchtime, and a few structured fun activities. Keep in place any existing routines such as story time, evening TV, and bedtime rituals. Modeling healthy habits for children shows them how we can all work together to do the right thing. This includes managing media coverage of COVID-19. Consider limiting news and social media to a specific time each day. Be mindful of news running in the background with your children present, or frequently discussing the news when they're in the room. Try to substitute things that support positive coping, playing a game together, watching a funny show, or making a gratitude list before bedtime. Most importantly, don't forget to prioritize your own self-care. Simple things like getting enough rest, eating well, exercising regularly, and seeking support from trusted friends and family can increase your resilience in stressful times. The more you can do to keep yourself healthy and balanced, the more you'll be helping your child feel safe, calm, and worry-free.
If you think you or a family member may have been exposed to the virus and have symptoms of a respiratory illness, please call your doctor or care team for further instructions. If you are a Kaiser Permanente member, call the number on your membership card. It's important to call before you come in. Calling ahead helps us direct you to the most appropriate care and take precautions to protect other members, patients, employees, and physicians.